Hey guys, Dr. J here, and this week I'd like to slow down Move With Me Monday to talk about something I'm seeing a lot in practice right now, which is stress-induced upper back pain, neck pain, and headaches. Right now there's a lot of uncertainty in the world. We don't really know what things are going to look like, what's going on with our jobs, so I am seeing a lot of these physical complaints right now as a response to stress. There are a lot of other physiological responses within the body that happen due to stress and due to increased cortisol levels and activation of the sympathetic nervous system or the fight or flight nervous system. But the one that I can really comment on are the physical manifestations in your musculoskeletal system in terms of headaches, neck pain, and mid-back pain. Now, there's a lot of things that you can do to help with your stress levels. Exercising, finding something that you enjoy in terms of biking, walking, running, hiking, resistance training. Those release endorphins, which can be quite helpful for stress levels. Making sure you have a good network of friends, family, or coworkers, people that you can talk to. And when needed, any mental health resources, which can be really helpful for developing coping mechanisms or having someone to talk to when you need to. One of the number one interventions along with exercise that I'm able to recommend and that I do recommend in practice are breathing exercises. We actually control a lot of processes in our body through our breath, and our breath actually can directly relate to our level of activation. When we are born, we're born as belly breathers, which means that our bellies expand and contract as our lungs fill and release air. This is because the diaphragm moves up and down to allow movement of the lungs. And that's why we see the stomach come out, is because the diaphragm is pushing the organs down and allowing them to come out and then coming back up, and the belly goes in. Now, as we get older, due to a multitude of processes, in this day and age, we see a lot of people becoming chest breathers or shoulder breathers, which actually brings in a lot of the accessory breathing muscles like your traps and the intercostals in your rib cage to work a lot harder to breathe where they normally should not have to. This type of breathing actually also activates your sympathetic nervous system, which is the fight or flight nervous system. So that actually directly relates to stress levels. So in terms of breathing exercises, what I'm going to do is I'm going to coach you through how to figure out what type of breather you are with a simple exercise, and then I'm going to show you a breathing exercise that can be done lying down because it can make you a little bit lightheaded because you're teaching your body to breathe differently. I recommend trying any of these for about 1 to 3 minutes, so you can set a timer and close your eyes when you're doing it. Don't go over that for the first little while. So really make sure you're in a comfortable spot while you're testing this out and when you're doing your breathing exercises. So if you're ready, here we go. So for myself, I actually notice that I'm a little bit of a mixed breather when I take the time to figure out where my breaths are coming from. I do take the time to try to do this exercise often, so I think that's why my stomach does recruit, but oftentimes it's mixed. So what we're going to do for the exercise is we're actually going to go back into that position. You can set yourself a timer for about 1 to 3 minutes to start. You don't want to do it for a lot longer than that just to get yourself used to it. And what you want to do is you really want to focus on only having the hand on your stomach expand. What's going to happen when you're doing that is the diaphragm is going to drop down, make room for the lungs, and then on the exhale, the diaphragm is going to pull up, the stomach is going to pull in, and the lungs are going to expel air. So if you're ready, here we go with the exercise, okay? All right, so I hope you enjoyed that exercise and you're coming out of it feeling a little bit more relaxed. So like I said, start with 1 to 3 minutes a day. Really try to control that breathing. You may end up, as you go on, taking time through your day to check in on your breathing and check in on how you're doing if you're feeling stressed or overwhelmed. This is a simple exercise. You can do it at your desk. You can do it sitting up once you get a little bit more in tune with it. If you have any questions, feel free to reach out. And if you're feeling like you need more resources or need more help, there are mental health professionals out there and they are there for you. As always, stay safe, everyone.